friends, welcome back to Alpha Physio Pelvic Care, all things pelvic health. My name is Anastasia Varova. Welcome to my channel, and here you will find all the tips about pelvic floor, pelvic health and beyond. Today I would like to touch a very important topic, and let me know if you have heard or maybe followed all the myths that happen to you after giving birth, because I have lived through them myself. Talk about 3 post-pregnancy myths that probably every other of my clients, and maybe more than every other, maybe 7 in 10, are hearing from society, even from doctors, from their friends, and from all other sources. Let's have a look. Myth number 1. You are ready to exercise as soon as your doctor discharges you. That is usually after 6 weeks. No, guys, no, you're not ready to exercise after 6 weeks. Being in this profession for 10 years, I can tell you that very few women are ready to exercise as they were exercising before pregnancy or even during pregnancy, especially when they did quite serious fitness, CrossFit, heavy lifting, running, jumping after 6 weeks. Pelvic floor goes tremendous stress during pregnancy. If you had vaginal delivery, your pelvic floor had overstretch injury, and probably, a very likely possibility, you had also some tearing that needs time to heal. If you had a cesarean section, it's a major abdominal operation. I have never, ever yet to see any abdominal operation, and I have seen many besides C-section. I have seen various abdominal operations. I have also seen orthopedic operations. None of them was suggested. You can go and exercise 6 weeks. Bye. Get your membership in the gym and go and exercise. You need to undergo at least 6 to 8 weeks specific pelvic floor recovery, diastasis recta recovery, to make sure you engage your pelvic floor correctly, to make sure there is no lasting injury. If you had a C-section, to make sure you're healing well, you need to work with your scar, you need to work with your breathing, you need to work with your posture. Besides that, let's be real, we're jumping into the world where we have to take care of the babies and we don't sleep. If you take the resources out of your life, and most of the time, for most of the moms, it's sleep, and put it in the exercises to get you back in shape, because, well, who expects? Society expects for you to get back in shape straight away after giving birth, then you are just robbing yourself from energy. And not in the long run, even in a midterm run, you will just burn out. You will just burn out, you will start problems with your thyroid, you will start other problems with your sleep. You will be having that extra weight from all that stress hormone cortisol, and you will not be able to lose it. Not because you're eating a lot, many people are actually eating very little trying to lose that weight, but because you went to exercise too soon. Plus, if you do all your classic crunches, all your jumps, all your running without doing rehab for your pelvic floor, you're risking it even more to get problems like urinary leaks, like fecal leaks, like pelvic organ prolapse, and many other pelvic floor issues. I have yet to see a person who would not be given a specific rehab protocol after an abdominal operation, and they're allowed to return to normal activity 3 months plus after they have followed through the protocol. So let's apply it also to the postpartum. Number 2. Here goes one more, my favorite. You're ready for sex after 6 weeks when doctor has discharged you. Dear friends, you are ready for sex when you are ready for sex. And that can be after 6 weeks. No one is blaming you. I have seen women having sex for 3 weeks after giving uncomplicated vaginal birth and getting pregnant again. That's absolutely fine. If this is what you want, this is what you can. Vast majority of women would have some kind of injury to their vaginas. They would have C-section stitches. And vast majority of women, even if not breastfeeding, they will have increased dryness of vagina. So even that will make sex quite unpleasant and painful. So jumping straight into intimacy after 6 weeks, you can, if you wish, but it's not set in stone. You need to take your time, you need to get used to your body, you need to appreciate your body, you need to take your time to rest, you need to prioritize sleep, you need to get your health back in check, your mental health back in check, your connection with your partner in check. So many other things are going on. There's a lot more attention drawing to the baby at that point in your life than to your partner, and many other things. There can be physical obstacles such as pain because of the scars, and this can be worked greatly through physiotherapy. There can be many reasons why you don't want to have sex 6 weeks after you've been discharged. So do not feel pressure, and the most important for the partners to know, and ask your doctor to explain to the partner, maybe find this video and show it to your partner, that 6 weeks is not a milestone measurement for returning to intimacy. Many women will require 3 months at least just to heal, just to get back to themselves. I have seen people who would delay it up to for a year. It's all about down to communication with your partner and how you feel about it. Number 3, probably one of my favorites. In order to get back to the flat stomach, to get rid of the mommy tummy, and to help yourself to recover faster, you need to start do abdominal exercises, crunches and planks. The more, the harder, the better. Whoa! This is highway to damage of your pelvic floor and of your abdominal wall. You start your postpartum pregnancy rehab with a lot of breathing, with a lot of static engagement of the pelvic floor and of abdominal. And quite often, when people start to go into abdominal exercises, they really forget about their pelvic floor and proper breathing. So they do contract their abs, but they get that extra pressure down on their pelvic floor because they just don't engage it right. And they create more problems for themselves than they started. Also need to see, preferably with specialists, why do you have that belly? Is it diastasis recti, abdominal separation? Is it just abdominal overstretch and weakness without diastasis? Is it pelvic floor weakness? Is it because your diaphragm is so compressed and it's so not working and you struggle with the breathing that it presses down and the belly falls out? I'm talking about this in the common posture types video that I have on my channel. There can be various reasons. Maybe it's a weak pelvic floor because weaker pelvic floor creates less support through the whole core muscles and therefore abdominals will be weaker as well. So you need to establish first why you have this belly. Or maybe it's so-called in, let's say, surgical terms, apron after the cesarean section, and you don't really have a lot of abdominal overstretch, but because the scar is tight and the rest of the tissues are hanging over, it creates like a belly. So you need to get proper diagnosis, individual program, and start again with a rehabilitation program. I hope this helped, guys. I hope this prevent you or maybe will prevent you from doing these kind of mistakes or maybe following these kind of, to be honest, false advice. Let me know if you had any of these, if somebody told you that, if you followed. There is no problem about that. We don't know what we don't know. I have done all these mistakes myself when I was pregnant with my first child and after giving birth, because I didn't know anything about pelvic floor back 11 years ago. Now I know better, and this is why I'm spreading my word to you. Thank you for your likes. Don't forget to subscribe, and we will see you back very soon. Take care.